The hype around AI in healthcare is deafening right now. Everywhere you looked at the recent eHealth conference in Halifax, Nova Scotia, you could see vendors were all talking about agentic AI and the application of AI in various places. And even though AI was being spoken about in a lot more practical terms, it still felt like the technology was being touted as the solution to all of healthcare's problems. After all, you could just prompt it, let your AI agents loose, and watch your patient engagement metrics run like a bike on a downhill slope. But the reality is that we're building that bike while trying to ride it, and we might have forgotten to build the brakes. Well, to get the inside scoop on this topic, I sat down with Julia Zarb. She's the force behind Blue by Blue, a company building AI infrastructure with governance baked in, not slapped on as an afterthought. Her warning to healthcare leaders: stop treating AI like a software update. Let's get to it. If you've been in health IT for more than a minute, you'll know the drill. A new tech wave hits, we write a few policies, establish a steering committee, maybe do a few pilots, and eventually, over years, best practices emerge that we can adopt well after those pioneers have blazed the trail. But AI is different. And I asked Julia to explain why we can't just follow the old digital health playbook when it comes to AI.
Yeah, it's interesting because um, what I think is happening, and I've been in digital health since, I have to say, since the '90s, even though I'm adding my age and decades in the field. Some ways it's so similar, so similar. We're trying to explain massive concepts to people and ask them to take it on at the same time. Sort of learn it, build the bicycle while riding it, and do it. But where it's not the same as digital health on steroids, to have AI coming into the mix, is it doesn't behave the same way as technologies have in past. And that behavior being so different is also invisible. So a lot of times, because of what I love about AI, which is that you can speak to your data, you can have your own self as the interface between the tech and what you want to happen. The potential is so incredible, and the actual use is really incredible. But the challenge about what's happening right now is what makes agentic AI good is also its sort of internal flaw that makes it almost impossible to rely on solely to carry forward truths. And it's the probabilistic, the repeatability, the way that we actually are able to capture and repeat information. So the way that it processes, it carries forward little micro fissures and flaws, etc. Right now our approach seems to be that we're all looking, and by all I mean, digital health and people, good people working on it, we're all looking from the outside in and saying, let's put up this guardrail, let's rinse it after, let's filter it after.
Microfissures. Ugh, that's a chilling thought when you're dealing with patient health. It could literally mean the difference between life and death, or a big bill versus a little one. Now, right now, the industry's favorite security blanket is human in the loop. We slap that on the labels on things like AI powered platforms or AI enabled workflows. And when you do that, executives in the C suite all exhale. Great tech? Check. Human oversight? Check. Reduce liability? Check. Or is it? Well, Julia was quick to point out that having a human in the loop isn't quite the safety net we think it is. And in fact, it might just be the exact opposite.
The AI is here, but there's a human in the loop. And we should, but there's a big sort of But what is happening is that actual term is being defined externally by legislation, international regulation, big cases, which have been allowed to turn into, like in the case of Cigna in the US, a class action suit, when those humans who have been put in the loop haven't had the time to actually look at the information, haven't had a structure that acknowledges that there's a bias that humans have when being fed information under high stress and fast pace. Um, and also haven't had the understanding of the accountability or the ability to escalate out of the situation they're looking at. So, in one hand, I've found items that say, I reviewed X number of charts in such a short time, which is great. However, what we're doing is transferring a lot of the liability that comes with that review if what's being fed up has things that are off or just not quite right. And we don't have what's called explainability to go back in and see how that got to it, who knew what, when, and where, and why. And that's actually what my company is focused on, is who knew what, when, where, and why, and to what end, right?
Transferring the liability to an overwhelmed person. Why does that sound so familiar? Oh, wait, that's a regular Tuesday in the IT department of most healthcare providers. So if people are struggling to catch these micro fissures in real time under high stress, can we just build a stronger, taller system of guardrails to keep that AI in check? Well, Julia says no.
One thing that's been really on my mind a lot is that we've been using the same means and methods and ways to deal with AI as we have with digital health. So, for example, I've even seen, in the U.S. and in Canada, in policy, we think, oh, if this worked, maybe we'll just make that guardrail or boundary, we'll just make it bigger and stronger. But AI doesn't work like that. It jumps the guardrails, it jumps boundaries. So there's what's being created. It's not as much as AI debt, which I think there is, which is, errors that propagate. I think it's a different understanding of the way that we can actually hold accountability for information we have at hand.
It jumps the guardrails. Yikes. So, what happens when we do try to scale this up? If there's one boundary jumping AI that makes a tiny logical error, what happens when it starts communicating with dozens of other AI agents? How do we fix a system where the errors from a human perspective make perfect sense to the AI at the time? Well, here's Julia's take. And warning, it might be incredibly hard for a healthcare leader to accept.
My concern is this: if one agent makes a mistake, that's fine. If 100 agents make a mistake, then you've got 100 mistakes. If 100 agents speak to 100 other agents and those mistakes are brought forward, these aren't mistakes that are just errors. They're mistakes that make sense because of the way the AI is built. They make sense at the time, right? To the AI, it looks at its next nearest neighbor. It says, "Oh, this is probably true," and it's not. The problem isn't that it's coming up with big hallucinations. It's coming up with little gap fillers that will get by us. So I think the remedy is, ironically, to not try and over remedy now. So I've seen a lot of policy being going forward and then being pulled back.
Don't over remedy. That flies in the face of our instincts to build bigger, stronger walls around technology. But according to Julia, trying to shoehorn this brand new medium, as she calls it, into our old health IT playbook is just not a winning formula.
So I think the remedy is looking at our human in the loop a little bit more clearly, looking at the idea that AI is a new medium, and a new medium brings a new set of communication challenges, as did the internet. We are constantly trying to simplify and totalize what AI is. But I had a slide at one point that said, here's the internet from, and it was kind of a joke slide. here's the internet, and here's all the use of the internet. And the slide had just 100 different words on it, go, make my travel reservations, do this and that. We're trying to do that now. We're trying to put AI into a single slide and say, this is what it is. So, um, you know, the remedy is to keep trying to figure out what the remedy is and get comfortable with being uncomfortable, because we're going to be here for a while.
So, bottom line, get comfortable with being uncomfortable when it comes to AI in healthcare. AI is a phenomenal tool for ambient listening and data analysis right now, but it doesn't care about HIPAA, and it certainly doesn't factor in the level of change management that its implementation may require. And you heard from Julia about the dangers of too much human in the loop right now. Yet despite all those risks of doing something with AI, that risk is much more acceptable, in my opinion, than waiting until the industry figures it all out. We can't wait that long in healthcare. We can't let patients receive inferior care or have staff leave because of burnout. We need to act quickly, and AI does have some promise. Don't believe me? Well, consider if you had waited until websites were perfectly optimized before building one. How many patient appointments and how many physician hires would you have missed out? Huge thank you to Julia Zarb for cutting through all the fluff around AI in healthcare. You can connect with her on LinkedIn. That's Julia Zarb, Z-A-R-B. You can also email her at julia.zarb@bluebyblue.com. That's BLUEBYBLUE.com. And hey, if you enjoyed this video, please help us out by mashing that like button and clicking subscribe. I'm Colin Hung here in Halifax, Nova Scotia. Thanks for watching, and I'll catch you on the next video.